Welcome to this brief overview of RotaTrack. This is a dedicated rostering program written in fourth dimension. Fourth dimension software is used by companies such as Apple, Pfizer, Boeing, Hewlett-Packard, Siemens, and so on. RotaTrack is a skills-based automated rostering tool. It matches the task to the individual based on both skills, generic and specific, and availability, whilst also taking into account training requirements. The results can then be published either through web browser versions, PDFs, or standard printouts. And if required, they can also be exported to Excel. Here we see an example of a PDF showing both the shifts and the theatres. The shifts are entirely user modifiable and can thus reflect your current practices. RotaTrack will accommodate your departmental shift rules when allocating staff into the theatre sessions below. Looking more closely at the theatre sessions, it can be seen that the principal surgeon, the consultant anaesthetist, and the trainee are all shown in the PDF printout. If desired, the actual surgical specialty can be printed out as well. The obvious question is, how does RotaTrack achieve this? In order to answer this, each of the constituent elements will have to be looked at, and this is what will be done next. The first element that will be looked at is that of the session and the surgical list. Taking the list first, the shortcut button to the lists is clicked. Each list is associated with two skill levels, that of the anaesthetist, in other words consultant anaesthetist, and that of the trainee. The list name and the skill levels are entirely user dependent and entirely user configurable. In this data set, the maximum skill level is 12 and the minimum is 0. The minimum anaesthetist skill level refers to that of the principal anaesthetist, and this may be a consultant or a trainee. The minimum trainee skill level refers to the skill level of the trainee attached to the principal anaesthetist. The increasing number relating to skill level obviously relates to increasing experience and ability. Your particular unit may choose different milestones. For example, a level 6 may relate to a solo laparotomy, a level 8 may relate to a total hip replacement in a sick patient, and a 10 may relate to a final year trainee. In addition to the generic skill levels, there are specific specialty skills that may be assigned to each specialty list. For example, in pediatric orthopedics, the specific specialty skill of pediatrics is required. The specialty skill level and the specific specialty requirement together define the complexity of the surgical task. The properties of the session can be further modified by looking at the actual session detail. Here we'll look at Theatre 3 General Surgery. This view shows the Wednesday morning session, and we can see that we can increase the skill level required. We can increase the priority of having anaesthetists being assigned to this list. We can link the morning list and the afternoon list together. We can make the list mandatory. We can further stipulate whether this is a non-training list, or indeed whether a second trainee can be assigned or not. The next element to be addressed is the detail of the consultants themselves. This is to be found in the staff list, and this is a list that contains all the different members of staff within the theatre complex. Here we will just look at the consultant anaesthetists. Each member of staff has a personal portfolio, and here we will look at Dr. Kathy Beeching. Here we can see that she is a consultant. Her type is anaesthetist, in other words, the system recognises her as a consultant anaesthetist. We can set the date of activation, and if known, a date of inactivation, for instance retirement or moving to another job. We can set the default quota base date, which is the date from which all types of leave entitlements are calculated. We can instruct the program as to what to do with the individual when it comes to floating sessions as opposed to fixed sessions. We can set the specific skill level of the individual. We can look at the qualifications and skills. We can define whether or not an individual is part of a particular leave grouping. We can define leave quotas. We can set the working hours, and indeed we can show whether or not an individual is a part-timer. We can set leave quotas. We can define the working hours, including part-timers if required. For trainees, we can set training modules with start dates and finish dates. The individual's default sessions can be shown, and these are their fixed sessions. Any assigned duties or shifts can be shown. We can have a graphical display of what the individual was doing for a particular week. We can see any diary bookings. The on-calls can be automatically generated for all the consultants if required. Any set duties such as on-calls can be shown. In the event of floating sessions, certain lists can be defined as either preferred or unpreferred if an individual has a particular interest in a list, or indeed if there is a reason for not doing them, such as a female consultant who might be pregnant not wishing to do radiological procedures. If there's an issue about individuals actually being able to work together, this is dealt with under personality clashes, and it can be ensured that these individuals do not work together. In the event that extra hours of work are being tracked, this can be logged in this final tab here. Once the details of the theatre sessions, the lists and the anaesthetists have been entered into the system, the vast majority of the day-to-day working of RotaTrack involves the use of the